Good evening, everyone. I'm so happy to be here to spend this time with you this afternoon. I want to thank Dr. Sankey and Emmeline for inviting me to speak on this important topic. So in starting, I was speaking on the topic of helping adolescents achieve a healthy mental health. And the reason why this is so important is because our young people are faced with so much today. Something is happening. Adolescence is a time of dramatic physiological change, social role development, physical, emotional, and social changes, including exposure to poverty, abuse, or violence. And all of these can affect young people that cause them to develop mental disorders. Tonight, I'm just going to share with you some statistics. We understand that during the COVID-19 pandemic, a lot of young people had to be isolated in their homes. And this triggered off anxiety and also depression in many children as well as adolescents. So today, I just want to give you some statistics. According to the mental health shows that according to Mental Health America Youth data, it showed that 15.8% of youth aged 12 to 17 reported suffering from at least one major depressive episode in the past year. And this is the data for 22. 10.6% or over 2.5 million youth cope with severe depression. 4.8% of youth in US reported having substance disorder in the past year, which is 1.6%, and 1.6% had an alcohol disorder in the past year, while 3.16% had an illicit drug use disorder. The National Institute of Mental Health reported also that 31.9% of teens have some type of anxiety disorder. 8.3% of those with an anxiety disorder have some impairment as a result. And 38% of female teens have an anxiety disorder, while 26% of male. Now, we talk about the statistics for the mental disorder, but we now will look at some risk factors. The risk factors that young people are facing with today are some of them have difficulty adjusting to society, lack of emotional support in their home, being bullied at school and online, living in an abusive or violent home, and experiencing a crisis such as a death or divorce in the family. And of course, we think of economic problems. But our young people today, believe it or not, they're also facing difficulty in sexual orientation or gender identity. When we were coming up as youngsters, we didn't hear so much about transgenders and all at times in our time, but now it's open. And so some young people are being faced with the situation of having difficulty with their sexual orientation. Also, excessive use of technology and social media. So you find that because of how the society is today, that is causing a lot of anxiety and stress in adolescence. So we talked about the risk factors. Those are in our environment. But let's look at what causes anxiety and depression. It's good to know what causes so that you can have an idea how we can go about helping individuals. Now we look at genetics. So if a parent or someone in the family has this a mental disorder, that's you have that gene. But because you have that gene does not necessarily mean that you will be affected. It just means that you have the genetic makeup. Often, what we talked about in the environment, those risk factors can trigger that gene. Then we think about trauma. We think about emotional trauma, sexual abuse, physical abuse, and sometimes even as a young person witnessing some kind of abuse to others can also be traumatic, and that can cause anxiety. That can come in the form of post-traumatic stress disorder. Then, of course, immature prefrontal cortex. The frontal cortex, prefrontal cortex, which is the executive part of the brain, where you're able to think clearly and reason, it's not fully developed until maybe 25 years old. And so you find that adolescents, because their prefrontal cortex is not fully developed, they can be impulsive, engage in risky behavior, sometimes not being indecisive, and not, of course, not making good judgment because the prefrontal cortex is not fully mature. So we can have problems in that area. And of course, we think of hormonal changes, increased estrogen, progesterone, and testosterone, and you find that young men may become more risky, become sexually active. So all of these things that's going on in their body can contribute to mental changes. And then you have negative thought processing, how they feel about themselves, what I've been influencing in their life. Have they been full of a lot of negativity? Because if as a child have been exposed to a lot of negativity, then they will grow up with negative thought processing. So that's the part that we really want to work with our young people. And of course, as I said, those risk factors, the environment can also trigger off mental disorders. And then you have substance abuse. So in understanding that, let us look at the signs and symptoms of depression and anxiety, because if you can recognize these in your young people, then they can be treated or helped. So what do we look for in depression? If you've noticed that your young person has lost of interest in things they once enjoyed, lack of energy, they're always tired, they're sleeping too much or too little, spend time alone and avoid social activities with friends. If you had a young person who was usually very sociable and all of a sudden they become isolated, that's something that we can be, let our red flag goes up. And obsessive preoccupation with their physical appearance, such as skin and weight. And you notice that the young people, especially when they're engaged in a lot of social activities, on social media, they think that if they don't look like that, how they're supposed to look, because society say you should shape a certain way or look a certain way, sometimes you find that young people become preoccupied with their appearance if they're not looking the way they're supposed to look according to society. And of course, if you notice, poor school performance. Changes in appetite, either eating too much or not eating very much. Spending excessive time on social media. And when they come off social media, they're feeling anxious or sad. And I talked about that just now because they spend so much time on social media, and then they're getting all kinds of ideas that's, geared at targeting them. And then they either feel anxious or sad. And then Sometimes they may engage in substance abuse or thoughts of suicide. So these are things to look forward to, to look out for if you notice your adolescents behaving in any way that's a sign of depression. Now let's look at anxiety. What to look out for anxiety is difficulty regulating emotions. Sometimes very excited, also very excitable. Difficulty concentrating, sleep disturbance, having trouble socializing in person, displaying fearful behavior or displaying aggressive behavior. These are some of the presentation that an adolescent can show, signs and symptoms that they can show. And if this behavior occurs for over 2 weeks or more, it's time for you to get them to see a physician. But it's important that you are aware of what to look out for. Now, how do we treat our adolescents? Medication, and psychotherapy, or lifestyle changes. We're going to go into lifestyle changes, which is so important in keeping our young people healthy mentally. So the medication that would be used for them would be antidepressants, which would decrease their depression. It doesn't cure the depression. Medication only decreases the symptoms that they present to it. And of course, anti-anxiety medication helps to reduce the anxiety, such as panic attacks, fear, and worry. So basically, antidepressant will help the student or the adolescents to concentrate more in school, and it will give them more energy. But remember, medication, as if some of you are nurses, does not cure the disease. It just decrease the symptoms of anxiety and depression. So I mentioned those. I mentioned medication. Now let's talk a little bit about psychotherapy, and then we go on to lifestyle. Now, psychotherapy is what you call talk therapy. They've got several different techniques that are being used in psychotherapy, but the most common one that's used for treating anxiety and depression is called cognitive behavioral therapy. Cognitive behavioral therapy is when it involves in changing, reframing negative thoughts into positive thoughts. And believe it or not, the Bible talks about this. The Bible talks about it in Philippians, which is what I will probably quote at the end of this session, that our thoughts affects our emotions. It not only affects our emotions, but it affects our behavior. So psychotherapy is basically psychotherapy, no matter what technique is used, it involves communication between client and therapist, and is intended to help the person identify and change troubling emotions, thoughts, and behavior. So basically, that's what talk therapy is. It's helping you. So sometimes medication and psychotherapy goes hand in hand. Some people choose not to take medication, but that's when lifestyle change is very important. So let's look at lifestyle changes, which I know is very, very familiar with you all, because this is what you teach most time. So this is what we'll be teaching our young people. So a healthy lifestyle can treat multiple mental disorders. And we try to teach this to our clients because it's essential for a healthy mental outlook. So what are the healthy lifestyles? You all teach it. Aerobic exercises, and I will include deep breathing exercises, adequate sleep, plenty time, spend time in nature to get fresh air and sunlight. Sunlight, fresh air, very, very important. And of course, we know eating healthy is also good. and also reducing the time spent on social media to less than 2 hours. So your adolescents need to know that social media, spending a lot of time on social media is really not going to be helping at all. So when we talk about exercise and all that, but having a good relationship with family and friends, very, very important. When God created us, he made us as social beings. We need others. Praying and reading the scriptures, recreation and enjoyable activities, humor, music, avoid pessimism, cultivate an attitude of gratitude. So we know that these things are necessary for a healthy outlook, right? If I've missed anything from here, I would, we can talk about it afterwards. But it's very, very important that for treatment and anxiety, there are exercising. Movement is important because it releases endorphins, dopamine. So all the neurotransmitters, the healthy neurotransmitters are released, and that can also help their mood. So we talked about a little bit about the lifestyle changes. Diet is very important because food is important for mood. And as you all know, what food are important to help our mood. And with young people, it's extremely important that we encourage these adolescents to have a healthy breakfast. Sometimes they go off to school without breakfast. And it's important that they have breakfast because it's good for their brain. It makes them alert so that they can learn. And they eat 3 meals a day, healthy. And of course, protein, fat, and fiber, as you know, all these meals are extremely good for our adolescents. Instead of eating snack when they're having snacks, instead of eating junk food, it's important that they snack with fruit or vegetables. And avoid drinks that are high in sugar, including soda and sport drinks. And as you know, sugar is really not that good for the brain because a lot of times you find that sometimes it can cause them to be hyperactive. So it's good for these adolescents to avoid these drinks that are high in sugar. Now, some of the brain food, I know you all know these because you study this a lot, you teach this a lot, but they need to have food high in tryptophan. And I know some, vegetarians will not be eating tuna, but they can get their omega-3 from other food substances. We have fruits, blueberries, avocado. We know olive oil, walnuts, and other nuts. These are good for the brain. And plenty water, lots of water. So now we've talked a little bit about how eating healthy and exercising is good for our mental health. This is what we have to, for those of you who have adolescents, who have grandnieces or grandchildren, this is what we need to encourage for our young people, that they eat healthy and stay away from junk food because those are not good for the brain. So now we get to the part, how can we help our young people to develop, to prevent them actually from having a mental disorder? The truth of the matter is we don't have to wait until these children are adolescents. We start from they are young. We start from when they're young to spend time with children, spend time enjoying activities, teaching them values, giving them the love and attention that they need, unconditional love, and of course, we also know that have family worship daily and be an example in the home. It starts from when they're little. We don't wait until they're adolescents to start. So how are we going to help them now to not have mental disorder? It starts from when they're little, by letting them know that they're loved and whatever problems they're having, you can spend time with them. So communicate openly and honestly. Talk about their values. Guide them in making healthy decisions and solving problems. Remember, we talked about their prefrontal cortex is developing until they're at least 25 years old as an adult. So we have to do as much as we can to teach them good values. Let them like who they are, appreciate themselves as they are, not trying to be like others, but appreciating who they are, and teaching them about God, because God is their strength in no matter what they're going through. It's important that we do that with our young people. And become engaged in school activities and help with their homework. Communicate regularly with teachers and administrators. Have a conversation about drug abuse. This, even though they're we may be Christians and our children, we may not expect them to be getting involved with drug abuse. Have a conversation with them about drug abuse. Let them know that is not good for them, and encourage them, and let them know that you appreciate love, give them love and attention and support. So basically, in order for us to help our young people to grow up with healthy, we as parents, aunties, grandmothers, I don't know the status of on our platform, but we have to be there for them, to help them to be able to think logically, guided by you being with them, listen to them, because you have to help them to develop healthy, because sometimes they are not able to think for themselves. And with love and reassurance and prayer and trusting in God, we can get there. So I'm sorry that I started off a little bit rough, because of my computer. I'm still trying to figure out what went wrong. But basically, I just put some crisis outline up here, because with young people, it's very important that you are observing them. If there are changes in their behavior, that you are able to get the help you need at any time. And to conclude, I would like to say that the Lord is close to the brokenhearted and save those who are crushed in spirit. And in closing, I hope that the information I have given you is enough, is helpful. And once again, I would like to apologize for starting with the problem with my computer.
Dr. Seballo, that was really informative, much needed information, as we are living in a society now where young people are having difficulty with identifying who they are and how they fit in with socially, even within families. So I think the information that you presented was so timely as individuals are preparing to go back to school. People wonder, what am I going to wear? So they're school shopping and they're trying to decide what they're going to wear because they want to fit in. But I do like that you mentioned how starting in the home, how we can have worship together with our young people, how we can encourage them, how we can affirm them, how we can be the first to say that they are smart or that they look nice, so that they're not seeking that attention from outside the home. So we'll open it up for our audience. If they have any questions, we would love to hear them. Any questions for Dr. Seballo?
This is Emlyn. I just love what Dr. Seballo just presented. It's so timely. And I even love more the part when you talk about what we eat, what we put into our bodies, how important that is. And I just want to say, I know there are a lot of parents, I guess, listening to us, and sometimes we are busy it's hectic getting up in the morning and having breakfast ready for our children, ready to go to school. I like the fact that you stress the importance of eating a good, healthy breakfast. And many a times, as I said, we're so rushed that we do not have time to prepare a good, healthy breakfast. So we grab the cereal, the Cheerios, and the Frosted Flakes and all of that. And although on some of these boxes, they have big and bold, healthy, but we have to be careful. It's not really healthy, because why I say it's not healthy? Because of the amount of sugar that's in these breakfast cereals. They are not healthy for our kids. That's the worst thing that we can offer our kids. As Dr. Seballo pointed out, how sugar, it takes over the brain. It makes the brain hypersensitive. The kid, as we all know, when we give kids too much sugar, they get hyper. And that is because it put the brain on overdrive and cause the child or children to be so hyper. So in the morning, instead of fixing or grabbing a box of cereal, take time out to give them some oatmeal. Oatmeal is healthy. Maybe the child might not like oatmeal, but try and get them to maybe put some fruits or something in there to to make it appetizing for them. Good whole grain bread, can be substituted. But let us get away from that cereal. That breakfast cereal is not healthy. If we can get alternatives that we can prepare, I guess maybe one of our presentations maybe is to prepare a healthy breakfast. That is so important. The best meal, the very important meal of the day, breakfast.
Yes.
Any other questions or comments?
If there are no more questions, what I'd like to do is I would just like to emphasize something that is so important, so important for our adolescents. And I know I said it, but I just want to say it again, that we have to be very careful with how we speak with our young people. When we're speaking to them, we have to make them feel important, listen to them, because, as they're going through their, like I said, because of hormones, you might find that they become sometimes emotional. Sometimes we just have to be there for them, to listen to what they're saying, be in their presence, not just being in the house with them, but be in their presence, to let them know that no matter what they're going through, because you don't know what they're going through at school. But if you are involved with them, they will come home and tell you whatever is going on. So the most important thing is to become present with them emotionally, and also be with them for whatever they're in need of. Because they may not tell you, because, as they get older, they think they're independent. They want to focus more on their peers. But the more you become involved with them and learn about, what is going on with them, then you will be able to help them to develop a healthy mind. And that's what we want, a healthy mind.
That is very good counsel, because I think the signs and symptoms, sometimes the ones that you mentioned, they could be somewhat subtle. And if we miss those symptoms or those signs, it's very possible that they may be either associating with the wrong group of people, or they may be thinking about, life is not worth living. So we want to make sure that, even though we may think it's normal for them to be on their phones or on social media for extended periods of time, we don't know if that's a way of withdrawing from the family and from connecting with us. So we don't want to miss those signs, because sometimes by missing them, they could be doing harmful things, whether it's involved in drugs or smoking or alcohol, or other behaviors that could be harmful to them. So I think for me, my takeaway is, watch for the signs.
Yes.
I think one of the things we also need to mention also is that we have to be very intentional about their associations.
Mm-hmm.
And the other thing we have to be careful of is our behaviors,
Yes.
because a lot of what they pick up is what they draw from us.
Mm-hmm.
So we can't always say it's the young people with the problem. We as the parents, a lot of times are the problem or have problems. But we say that, well, we can fix the kid, but everybody, it has to be a family affair. Everybody has to be in on the counseling sessions. Everybody has to be on group session, you know, and if they like social media, that's fine. What we've been fortunate to do is have a Vesper on Friday evening on a platform where the young people are there. We'll give them opportunity to express themselves. And we are like guides on the side. We would just give them counsel, not directives, just counsel about choices and options that they have. So I think we as leaders and families and parents and adults in the situation, if we make sure that, because if we have challenges, then if they see us getting counseling, they'll be more open to getting counseling.
Mm-hmm.
We're pretty set in our way of doing things and are not flexible. Chances are they're not going to listen to us, and they're not going to convey and have that confidence in telling us. A lot of times they won't tell us things because they're afraid they'll get in trouble.
Mm-hmm.
So we have to be pray for guidance, first of all. Pray and ask God for guidance in dealing with them and ourselves, you know, and then being able to kind of be intentional about their friendships and their relationships. And if there's changes, we have to be parents. We're not their friend, not their buddy. We don't have to be mean to them, but we have to let them know that we do have a level of expectation for their behavior. Now, once they become adults, I mean, they're going to do some stuff. It's not like we didn't try as parents. But as long as they're under our care, then I think we are able to direct and help them with their choices. And the more structure they have, young people want that. They need that. So not giving them too much latitude. That's just my personal opinion. I mean, as I'm looking at it and having dealt with young people a little bit, that they tend to like the structure more than just absolute freedom, because then they feel like they have to solve their problems. But if we give them directives, then it will help them. And so, you know, as a adult or a family member, teach them that, look, I'll have expectations for you. If you're worried about your friends, tell them it's because of me. If they don't want to handle it, not mature enough to handle it, to say, well, my uncle or my dad or my cousin or someone told me I can't do anything on my own, you know, just something to think about.
Yes, thank you for your input. Very valuable. Thank you so much.
I just want to share a book with the audience. I took a course on depression and anxiety with Dr. Neil Nedley. Dr.
Yes.
Neil Nedley, very experienced doctor who treats his patients with a healthy lifestyle. And Dr. Nedley is known to help patients, individuals with depression, patients who were on a slew of medications, they can get off their medication and live a healthy life by learning coping skills and diet and how to take care of themselves. And one of the books that he used in his session was this book, SOS, by Lynn Clark. And it's a book that can help anyone how to control your emotion, your thoughts, how to, you know, challenge it in a way where it does not overpossess you, but you are in control. And this is a helpful book. So if anyone is dealing with emotional anxiety, this is a book I think I would recommend them to read. SOS, Managing Anxiety, Anger, and Depression by Lynn Clark. Lynnnclak.
Yes. Thanks for sharing that book, Emmeline. I used to do Dr. Nedley's Depression and Recovery Program at Forest Lake Church, and I have that book.
Yes, yes.
Thank you so much for bringing it up. It is true. It is true that lifestyle change is the most important to keep. You see, people do not realize that what they eat affects their mood. But Nedley brought that up very clearly, didn't he, Dr. Nedley?
Yes.
That our food can affect our mood. And it's very important that we eat healthy, we exercise. All of us, not just adolescents, we get sunshine, we drink a lot of water, we get adequate amount of sleep, and we pray. We must never leave out prayer and meditating on God's words. And these are the things that we need to introduce to our young adolescents also, because those things are necessary in having a good mental health. And I spoke a little bit about cognitive behavioral therapy, but I want to share Philippians 4, verse 6 to 9. Whatever things are good, whatever things are noble, whatever things are good report, I'm just paraphrasing now, think on these things and we will get peace. So with my clients, I usually try to introduce that text to them because, believe it or not, that's cognitive behavioral therapy in the Bible. We teach clients how to reframe negative thoughts by reframing it, taking negative thoughts and reframing it to thinking positive, which can also help them to decrease their anxiety and stress level.
That is wonderful. Emmeline, people are asking the name of the
book.
You can
yes, and someone told me I need to hold the book further away. So the book is SOS, Help for Emotions, by Lynn Clark, Lynn. First name, last name is Clark, Clark.
You put it in the chat because we still can't see it.
Oh, you can't see? Okay, sure. That's a good idea. Thank you, Ivan. Okay.
Any other questions for Dr. Seballo? This has been really helpful. What I glean from it is it can help adolescents and adults.
Yes.
My belief that, you know, what we've heard today is not just for the young people. You know, sometimes we too also go through anxiety or depression, or various things can happen in our lives. And unless we channel our emotion and stay focused on God and pray, that we can be imbalanced. And what I would say is, as soon as you recognize that you don't feel like yourself and you're beginning to withdraw and your behaviors are different from normal, do something about it. Ask yourself, what have I eaten recently? If it was a lot of sugar, that's probably why. Ask yourself, am I getting out and getting the fresh air and walking and getting the sunshine that I need? If you're not, that's probably contributing to how you're feeling as well. And then many times, this one simple thing we can do is when people are not calling you and you think no one cares, reach out to someone else and show that you care for them. Because sometimes we're waiting for someone to, you know, extend kindness and love towards us, when indeed we should be doing that for others. Any closing remarks, Dr. Seballo? Any closing remarks?
Oh, you want me to close?
Yes, please.
Oh, yeah. Oh, well, I'm sorry. I was waiting for somebody to say something. Yes, what I would like to say is our adolescents are faced with, which I did say in the introduction, far more challenges than any of us were faced with, you know, growing up. And we just have to, you know, to reach out to them as much as we can, loving and, you know, teaching them those, I mean, our nieces, our nephews, grandchildren, whoever that we come in contact with, that, you know, directing them. But I think the most important thing is letting them know that God loves them and they're children of the King. And whatever they're going through, he will always be there to help them. Sometimes, even if their parents may not be the great, the best that they should be, but knowing that God is there to help them, pull them through whatever they're going through is so important. So important, because you can have children coming from troubled background, but just knowing that someone there, big, loves them. We need, they need that. They need that.
Wow. Well, thank you again, Dr. Seballo. My key message is, like I said, let our children, let other people know that we value them. See the good in them, see the good, and speak life into them, speak good into them. And many times we want them to do a huge something, but if it's something that they've done that's kind and nice for you, say thank you. Show them that kindness and respect, because sometimes that's the only thank you they may hear from within the home. And I'll give this example. My mother, who had 5 children, she made sure she affirmed each one of us with one of our skills. We're all different, but she affirmed us in who we were as an individual. Never compared us to anyone of our siblings. And I will always remember that affirmation. She knew we weren't perfect, but what we did well, she made sure that she told us that we did well. And so what I would say to us, for our nieces, our nephews, our children, our grandchildren, when we see them do good, affirm them, smile, compliment them, and let them know that you love them. Just saying, I love you can go a long, long ways. Thank you again, Dr. Seballo, for being here. We would love to have you come back at another time and talk more about mental health and wellness and how we can keep our minds in perfect peace and keep our minds stayed on God. And so we're going to stop the recording and we're going to ask for prayer requests, because we know there is power in prayer.